Okay, today we're going to cover contraceptive methods. So first we'll go over the different types of contraceptive methods. They can be categorized into hormonal, long-acting, reversible contraceptives, barrier methods, permanent methods, and emergency methods. First we have hormonal methods, which can include oral contraceptives. There's two common types, which is combined, which contains both estrogen and progestin components. And then we have progestin only. Both of these work by suppressing ovulation by inhibiting FSH and LH release from the hypothalamus. Next, we have long-acting reversible contraceptives. These include both hormonal and non-hormonal methods. Hormonal methods include some hormonal implants. An example of this is an Nexplanon. It's a small rod-like device that is implanted in the dermis of the skin. It's FDA approved to remain for 3 years. These work by continuously releasing progestin. Then we have hormonal IUDs. These are devices inserted into the cervix. Depending on the brand, some hormonal IUDs are FDA approved to stay in place for 8 years. These work by locally releasing progestin. Then we have non-hormonal IUDs, such as the copper IUD. These are devices inserted into the cervix. They are FDA approved to stay in for 10 years. They work by stopping fertilization by creating a spermicidal environment. Next, we have barrier methods, which include male condoms, female condoms, or diaphragms. These work by physically blocking sperm. We also have spermicide, which instead of physically blocking sperm, chemically kills sperm. Next, we have permanent contraceptive methods, which includes female and male sterilization. For female sterilization, this can include tubal ligation, which is when the fallopian tubes are cut, cauterized, or a portion is removed, which hinders the meeting of an egg and a sperm, or salpingectomy, which is complete removal of fallopian tubes. For male sterilization, this includes vasectomy, which is a simple procedure where the vas deferens are cauterized or clamped, which hinders sperm from entering the semen. Finally, we have emergency contraceptive methods. There's a few types of these. We're going to go over levonorgestrel, which is a Plan B pill, copper IUDs, and ulipristal acetate, which is known as ELA. For the Plan B pill, this inhibits ovulation from occurring before fertilization occurs. It can be taken within 3 to 5 days after unprotected sexual intercourse to stop ovulation from occurring. The copper IUD can be inserted by a healthcare professional within 5 days of unprotected sexual intercourse, and this prevents egg fertilization. And then finally, ulipristal acetate is a pill that can be taken 5 days after unprotected sexual intercourse to prevent ovulation from occurring. This one works similar to the Plan B pill. Abstinence from sexual intercourse during known times of ovulation is also another contraceptive method. Clinical assessment and diagnostics. Most forms of birth control are relatively safe with low risk for contraception. Personal and family history should be centered around contraindications of estrogen use and intrauterine devices. One of the most common birth control methods is the combined oral contraceptive pill. This is a pill that contains both estrogen and progestin. Because the estrogen component can increase the risk of blood clots and some types of breast cancer, it's important to screen and monitor patients who may be prescribed this medication. Here's a list of absolute contraindications. This list is known as Category 4 conditions set by the U.S. Medical Eligibility Criteria. And this list is from UpToDate. So some of these contraindications include age over 35 and smoking 15 or more cigarettes a day, multiple risk factors for cardiovascular disease, hypertension, pulmonary embolisms or DVTs, known ischemic heart disease, history of stroke, complicated valvular heart disease, current breast cancer, severe decompensated cirrhosis, hepatocellular adenoma, migraine with aura, diabetes mellitus of greater than 20 years duration, or with complications like nephropathy, retinopathy, or neuropathy. Contraindications for intrauterine devices. Some of these include distortion of the uterine cavity, active pelvic inflammatory disease, suspected pregnancy, unexplained uterine bleeding, and breast cancer. For the physical exam before prescribing contraceptive methods, it really just includes a blood pressure measurement. Pelvic exams are not routinely done, but some contraindications for IUD include anatomical abnormalities and pelvic infections, both of which should be ruled out during history intake and insertion of an IUD. Diagnostics and treatment. For diagnostics, pregnancy should be ruled out before prescribing birth control. In addition, if a patient has a family history of a clotting disorder like factor V Leiden, genetic testing may be indicated before prescribing. Clotting disorders and genetic testing really only applies to contraceptive methods that contain estrogen, because estrogen increases the risk of clots. For selecting a contraceptive method, there's many types, so what type of contraceptive should be individualized per patient. Patients have many different expectations, tolerability, and conditions. These different factors may make them either a good or bad candidate for a specific method. For example, any patient with a history of DVT or PE should avoid estrogen-containing forms of birth control. Another example is any patient who struggles with weight gain should avoid the Depo-Provera injection, which causes weight gain. Another example is patients who struggle to remember to take a pill daily should avoid oral contraceptives and opt for a long-acting reversible contraceptive method like the Nexplanon. It's important to note that condoms are the only type of contraceptive method that protects against STIs. Birth control pills, patches, implants, devices do not protect against STIs, and condoms should always be worn for safe sex. For education and counseling, some of these methods, like many medications, need to be administered and taken in a specific way to work optimally. For example, most hormonal birth controls should be taken at the same time every day to prevent breakthrough ovulation. For the patch, you should apply it to dry skin, change it weekly on weeks 1 to 3, and then leave the patch off on week 4. For the ring, it's similar. You place the ring into the vagina and leave it for 3 weeks and remove the ring for a full 7 days. Many forms of birth control have side effects that include weight gain, blood clots, mood changes, spotting, menstrual abnormalities, so patient counseling should be tailored to the specific type of birth control method prescribed. My research revolved around ovulation return after cessation of combined oral contraceptives. These are commonly prescribed for birth control, premenstrual syndrome, dysmenorrhea, PCOS. A common question that occurs is how long will it take for ovulation to occur after stopping this contraceptive method? So what does the research show? The average timeline for the return of ovarian markers to baseline and for ovulation was studied. In one study, ovarian reserve markers returned to normal within 2 months of combined oral contraceptive discontinuation. This was a long-term study where the average of COC use was 8 years. In another study, ovulation occurred within 15.5 days upon cessation of oral combined contraceptives. This was a short-term study where combined oral contraceptive use was about 3 months. So these studies show that even with long-term use of combined oral contraceptives, ovulation returns within 2 to 3 months on average. This is encouraging for patients who may want to become pregnant after stopping their contraceptive or who are concerned with long-term fertility. And then here are my references.